late again this month, your boss is going to fire you. He's already warned you. And so in order to speed up your time, you've decided to speed up your vehicle by 10 miles. And in doing so, there's an 18-wheeler that just overturned in front of you. You and your car and the car beside you in the next lane collide. You're in and out of consciousness, and you're on the way to the ER. Once you arrive at the ER, you can hear the nurses and the doctors talking, and they're not sure if they have enough blood because they've had a shortage, because not enough people have been donating. So then you begin to wonder, am I going to die? What about my family, my friends, the lady I was in the car crash with? What's going to happen to us? And then you remember the blood bank that you just passed by last week in your own community because you didn't feel like getting out of the car. And then you wonder, could that have saved my life? Could it have saved hers too? Could it have done anything? And today, I'm going to explain how important it is for you to go out and donate blood by explaining the process, the side effects, the benefits, and some of my very own experiences with donating blood. To begin with the process of donating, the American Red Cross in 2012 defined it as a 4-step simple process. It begins with registration, then a mini physical and medical history, then on to donation and refreshments. To start off with registration, you begin with filling out paperwork like you would in a doctor's office, and then you'll be called back, and then you will begin your mini physical and your medical history. In the medical history, they'll ask you questions that relate to your history and your parents' history, and if you have any diseases or have any chances of getting any diseases or any cancers. Once you finish that part, you'll be moved on to the mini physical, in which you will be checked for your heart rate, your blood pressure, your temperature, and your iron levels. If all of that passes, then you are then eligible to donate blood. And in that, you will go back and you will be sitting in a chair or lying down on the table, and you will have a nurse or staff member come by, and they will apply a blood pressure cuff or a tourniquet to the upper of your upper arm. After that, they will begin to watch your veins fill up, and then they will check them regularly. Once they are filled enough, they will apply a new sterile needle into your elbow. Once that happens, they will fill up 2 tubes for testing, and then a bag for the actual blood that's being donated. Once they have collected all the blood that they need, they will remove the needle from your arm and place a bandage around your arm. Once that happens, you will then be sat up for about 10 to 15 minutes and given refreshments to make sure that you're okay. After the donation process, you're possibly wondering, what side effects can affect me? What's going to happen to me if something happens? Today, I'm going to explain a few side effects. The Mayo Clinic staff on August 10, 2012 said that they advised parents and any patients donating blood to not do any heavy lifting or strenuous activities for 5 hours after donating, and not to remove the bandage for up to 4 hours after donating. Once you remove the bandage, if there's any bleeding, you need to apply pressure and hold your arm above your head for 3 to 5 minutes. After that, if you have any lightheadedness, you need to lay on a flat surface, and you need to have your feet elevated to about a 40 or 45 degree angle. If any of those symptoms occur, you're okay, and all you need to do is just be cautious. Also, if you have any pain, you're allowed to take pain medications. You're just not allowed to take any aspirin, Motrin, or ibuprofen. Now, there are some more serious complications that can happen, and if any of these occur, you need to contact your doctor or the donation center which you donated. And they include any continuous bleeding after you've applied pressure and you've held it above your head for 3 to 5 minutes. If there's a bump or pain that tingles from all the way down your arm to your fingers. If there is any nauseation, any lightheadedness, or any dizziness that continues after you've ate, drank, and relaxed. Or if you have any flu-like or cold-like symptoms that include sore throats, headaches, or a fever. You need to contact your doctor and tell them, and the donation center to let them know too. Now that I've discussed the process, the side effects, let's move on to the benefits. There are many benefits that can help you. The NFTV News crew in 2012 said that men have a chance of decreasing their chances of getting hemochromatosis by 50% in donating blood. Hemochromatosis is a health condition that involves buildup of iron in the blood. And with that, you can have health issues and heart problems too. So by donating blood, you've already decreased your chance of getting it by 50%. So why not donate blood? And another benefit of it is that your donation can save up to 3 lives, and the fact that somebody needs blood every 3 seconds. So with those two, you can save a life, and you can save up to 3 people's lives with your one single donation. Also, more benefits that are included are the mini physical that I explained earlier in the process, which includes a health check of your heart rate, your blood pressure, your temperature, and your iron. And another little perk that all women would love is that you can lose up to 1 pound. Who wouldn't want to lose weight? So now that I've explained the process of donating blood, the side effects, and the benefits, let me tell you about some of my own experiences. I was 18 when I first decided to donate, and we were walking through the mall as a family in Austin, Texas, and there was a blood bank that was set up in the middle. They asked us if we all would like to donate, and we decided why not? It would be fun. Of course, it was a little scary because it was my first time to donate, so I was a little worried. But as I filled out the paperwork in the registration process, it became a little more iffy. And then I thought once I'd passed my physical and my medical history, I thought, oh, I'll be okay. Then, as the process began, they explained everything step by step to me, and they helped me through my process. They made everything clear to where it was not a big worry to me and what would happen. After the process, they notified me about 7 days later saying that my blood was used for a patient that had been in a car wreck, which made me feel even better because my blood was actually used to save somebody. So, now that I've explained some of my own experiences, the benefits, the side effects, and the process, that should be a reason and why you should donate, because donating blood can save your lives and the lives of others. So go out there and donate blood.